back here again with our weekly interview with Dr. Nario. Dr. Nario is at Biointegrative Health Center in Reno, Nevada, and you can check him out online. Today, we are going to talk about another treatment. So we'll get to that, and welcome, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so let's talk about ozone. Ozone is a treatment that I've gotten at the clinic, Biointegrative. It's one I like. It's one that fascinates me. And I'm a healthy person, and I just like to get a bunch of treatments. So first, tell us, what is ozone?
Well, Steve, always going back to the basic question, what it is, right? Ozone. We always hear about ozone being part of the ozone layer, the ozone shield. So it's the Earth, of course, having a stratosphere that absorbs most of the sun's UV radiation and protects us from UV rays, making sure that our skin always smooth, no wrinkles, and free from skin cancer. And as we all know, this layer has a high concentration of ozone gas. So that's the one that we're going to be talking about, not the ozone layer. And I always want to tell patients about after a lightning storm, there's a smell, a certain smell. And the thing that you smell there is ozone gas. So just to make everybody familiar. So artificially in our clinic, what we do is we pass oxygen through a machine and we split it, the O2 into O1s. And then of course these O1s binds and to actually free oxygen, which is O2. Now they become the O1 plus O2 becomes O3, thus ozone. And there's so many different deliveries for this, and I'm just going to run through them because maybe later on I'll have the chance to discuss it. But the one that we are most involved with is the IV form and how to deliver it to patients. One through blood, which is the major auto hemotherapy, and the small amount of blood goes into a machine, and then ozone gets added to it and then infused to the patient. Or we inject the patient also with ozone, meaning another one would be removing the blood, putting ozone in it, and then infusing it on patients. And of course, this will bring in more ozonated or oxygenated blood, making it a bio-oxidative therapy. And sometimes we use also solutions that we ozonate and infuse on patients, such as solution carriers and even amino acids. And we inject them, we rectal insufflate them, like, yes, of course, underneath. That's what I'm talking about for the men. And even limb bagging for infections of extremities. And also for solutions like essential oils for skin infections, we ozonate these concoctions as well.
Okay, so that kind of describes what it is and how it's administered. I know you guys are big on the IV method of delivery there. That's what I've had there. So what would you use this for? Is there certain ailments, people that have certain sicknesses or issues or whatever, that you would use this particular treatment on?
Well, Steve, yes, there's a lot of things that you can do with ozone. One of my favorites, it's all as this trioxygen molecule is always highly water soluble. And of course, as defined by the American Academy of Ozone Therapy, is in the reactive form of pure oxygen that actually creates a curative response to the body. The effect of ozone is dependent on the dosing. So in IV form, if we apply or give low dose ozone, it stimulates the immune. It's a meaning in a good way. It's an immunomodulator. It supports many antioxidative pathways. When you talk about the medium doses of ozone that we give, it's just concerning now fixing the neurological, the cardiovascular. Even we use it for lupus, rheumatoid arthritis, cancer patients. Again, it's also at that level, it's an immunomodulator. And at the high doses, this is now what we call an immune stimulant. So this is when we have an acute infection of viruses, you always hear about that, and also bacterial infections. So immediate remedies or immediate, I guess, conditions that you need to boost that level up of ozone to kill a microorganism. And of course, yes, I just mentioned to you Prolo, which is what we do for people healthy that are like you, athletes who has knee pain, muscle injury. We inject ozone to stimulate inflammation to call in the repair cells and growth factors. And for rectal insufflation, we do that also. These are for the ones who actually has not gotten the chance to sit down on a chair and just wants ozone therapy, because the blood vessels are so rich in the colon and the rectum. If you put gas in there, it's almost going to be absorbed. But again, you have to remember it's not of the same amount compared to an IV infusion. And the other ones, when you inflate, like give it through the nose to kill nasal infection, even ear infections, and limb bagging for our diabetic patients who has almost gangrenous extremities. You put ozone in there to make the healing faster. And the saline solutions, we ozonate these solutions for wound cleaning and even essential oils for just aromatherapy and skin problems like eczema. And one more thing, very important, ozone generators. I highly advise that for our patients, especially now with the virus out there. It does make your house smell funny, but it actually kills not only the viruses, but also other infections in your home.
Wow, interesting. So you said you could inject this into an injury,
Yes,
like
you
a
can.
knee or a back or a, wow, okay. So let's say someone like me, I come in and I say, hey doc, I want an ozone treatment. Is that something that would be beneficial to me? And how would it be beneficial to me? I think I'm really healthy. How would that affect me? Why would that be good?
Well, that's a good thing about you. Everything we give you is just like he's the poster child for everything. He's going to have a good response. So that's why we like you talking about our IVs that way. But how it works is, as I told you, ozone is an unstable molecule. The thing here is it produces oxidative stress, and meaning it adds more oxygen to the system. That is a system that's lacking in oxygen. And especially with ozone, it interacts with our fats, meaning the layers of our cells, the outside layers of our cells, to actually create more beneficial reactive metabolites, such as EPA, DHA. So destroying that, irritating that cell layer to create more of that. Remember EPA, DHA from omegas, and also producing more water, and also ozone converts into hydrogen peroxide. And as I think we spoke about that before, and hydrogen peroxide also increases your water content and oxygen content that way. So for healthy patients like you, we usually just give the low dose one. As I mentioned to you a while ago, it's an immunomodulator to boost that immune system, and even an antioxidant to kill all these free radicals and possible infections. And the most common one for athletes that we see is we usually use these injections to fix specific spine problems, muscular problems, and even post-sport injuries, and rectal insufflation, as I mentioned, in intramuscular injection. I have even an athlete who just comes in to just get, hey, I need an ozone, just to give me a shot. Like for what? Just nothing. I just like that ozone, and I put it on his deltoid. So it's almost like it's almost like a B12 shot for him.
Wow. Okay, last question. So what IV combinations would you use with this? I know my wife does this with methylene blue, which if you guys haven't seen our methylene blue interview with Dr. Nario, that one's very popular. So what combinations, what would you do with this treatment?
Right. So as we all know, Steve, ozone is a gas that dissipates fast and absorbs really well through IV. And again, there are so many ways on how to make it creative for how you deliver ozone. And the best combos that I usually encounter would be the same IVs that produces more oxygen. So what are they? As I mentioned a while ago, hydrogen peroxide. Hydrogen peroxide is something that can actually boost more the oxygen that's getting delivered in the system. because ozone, just remember, turns into hydrogen peroxide. And you add more peroxide to already the peroxide produced by ozone, gives more of a fighting capacity for the body, especially to kill infections. And we use this a lot to treat cancer. And also you would see this combined with high doses of vitamin C. That's also another one. High dose vitamin C, once it gets into the system, turns into, again, hydrogen peroxide. So hydrogen peroxide is really the star of the show, if you can see. The one thing that when you think about it, you mentioned about methylene blue. We use that also in combination with ozone, more for boosting the effects of ozone therapy. So it's your bodyguard or an adjunct to the effects of ozone while we do it. So, but if you think about it, like, oh, we can use ozone on anything. Not really. There are other things also you cannot use with ozone, such as glutathione, because it's an antioxidant, because they're just going to negate each other in terms of the effect. But again, always check labs. Ozone, though a safe therapy, we always look for that blood test, which is called G6PD. And this is the one that protects your red cells not to burst if they get into an oxidative stress, meaning a high dose of oxygen. So always do this with a professional to be on the safer side of things.
Wow, that's a great treatment, great information, especially, you know, the peroxide, which so many things, you're right, peroxide is the star of the show so awesome, so often. So, well, that's Dr. Nario, Biointegrative Health Center. Thanks for being with us, doctor, and thanks for the information on the ozone treatment.
All right. Well, thank you, Steve. And as we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.